So just wanted to give a post-procedure update. I had my botulinum toxin injections yesterday with Dr. Sanovich, who is an oral maxillofacial surgeon here in Dallas, Texas. The reason why I got these injections in the masseter muscles, which are your chewing muscles, is because I tend to grind and clench my teeth even during the daytime. So nighttime I wear a night guard, but daytime I don't really want to wear a day guard. I'm just a physician going to work. There's no need to wear a sports guard to work. People just don't know I grind my teeth, so I'm just wearing my teeth away and I have no more enamel on my molars. So I wanted to find something that kind of help alleviate that. My friend Sheila Nazarian mentioned that you can get botulinum toxin injections in your masseter muscle, and I was like, oh my gosh, why didn't I think of that? We do, injections to spastic muscles for rehab patients that we take care of, but I just never thought about putting it in masseters. So I went to Dr. Sanovich. He's an oral maxillofacial surgeon. You want to go to somebody who's a specialist in this regard because there's a lot of muscles in the face, and there's a muscle that's close by the masseter called the buccinator, and this one controls your smile. So if you miss the masseter and you go into your buccinator, you might end up with an uneven smile. And the botulinum toxin usually lasts about 3 to 4 months, so you're going to have uneven smile for 3 to 4 months, which is not fantastic. If you can avoid it, that'd be great. So I highly recommend going to a specialist. An oral maxillofacial surgeon is like a doctor squared. These are like very, very well-trained facial surgeons. They go through dental school and medical school and surgical training for the facial aspect. So they're very, very knowledgeable about everything of the face. So highly recommend going to somebody who knows what they're doing for this injection. So he mentioned a lot of interesting facts about the masseter muscle. He mentioned that you really want to target the origin and the insertion points. So every muscle has an origin where it starts from and where it attaches into. Now usually for the patients that we treat for spasticity, we usually try to aim towards the muscle belly, and I would think that the muscle belly is kind of in the middle of the muscle, but it's actually not for the masseters. So he says mostly the muscle belly is in the origin and the insertion points. The other thing is I kind of noticed he was doing a technique kind of a zigzag kind of technique. I'm gonna guess it's just to reduce bleeding. I'm not quite sure, but you can see it in the video that I'm adding onto this video that he kind of did like a zigzag kind of technique. So I thought that was interesting. And let's see what else. So his prices were very reasonable. He was charging $13 a unit for botulinum toxin, which I think is very, very reasonable, especially given the fact that he's so well trained in this field. I had 25 units on each side of my masseters. He said that's a okay amount. Anything less, you would not really see much of an effect, and you'd be wasting your money. And let's see, 25 units on each side. Sometimes he says that he does target the temporalis muscles as well, but for me, I just wanted to kind of focus on the masseters to see if it would help. But the amount, the 25 units on each side, he said that I should get about a 30% reduction in my jaw clenching and teeth clenching. And I have to say that even day one afterwards, it might be part of the botulinum toxin. It might be just the fact that there was a needle going through the muscle, which sometimes can help alleviate muscle tightness. Like, I've already noticed a significant improvement. I haven't really clenched my teeth all day, and I've been checking in, as I do usually, checking in to see, oh, am I clenching? Do I need to relax my jaw? But I haven't been clenching my teeth at all. In terms of pain, it felt like a little bee sting. I think he went in like 4 spots, so it really wasn't that bad. I think when it was happening, maybe like a 4 out of 10. It's nowhere near childbirth, so it's not that bad. I don't really have any side effects. I'm not drooling. I'm able to eat okay with no problems. The other thing about this injection is one of the side effects is that you can kind of have a thinning of the muscles of the masseters, and some people do this for cosmetic reasons to narrow down the lower aspect of their face. Just kind of a nice bonus for me, I guess. I don't really mind the way my face is shaped, but it's not a terrible side effect. I can handle that side effect. Any questions, let me know. I'll be happy to answer them. I'll try to do a follow-up video in a month to let you know how I'm progressing. And he wants to see me back in 3 to 4 months to repeat this injection. He did say that usually people don't need to do it as frequent as other kinds of Botox procedures. Let's say for wrinkles, usually you need to go in every 3 to 4 months. But he said usually for the masters, for some reason, you don't really need as frequent of a treatment, which would be great because I would rather not get injected more than I need to, and I don't want to spend more money than I really need to. Alright, thank you for watching.